Production of West Virginia Public Broadcasting.
Support for the Legislature Today is provided by West Virginia University, offering education, healthcare, and the opportunity to achieve career success since 1867. Information at wvu.edu. Embassy Suites by Hilton Charleston, an all-suite hotel and conference center minutes from Yeager Airport and Capital Market. Reservations and brasserie dining information available at hilton.com.
Solar Holler, supporting Appalachian communities and building on West Virginia's history of powering the nation by bringing solar energy and battery backup to homeowners, nonprofits, and businesses throughout the region. More at solarholler.com.
Welcome to the Legislature Today. I'm Brianna Heaney. There are a few bills working their way through committees in the House of Delegates that aim to adjust state election laws. That includes House Bill 2400, which would prohibit mailing unsolicited applications for absentee ballots. House Bill 2131, which would clarify the West Virginia's legislature's authority over election laws. And House Bill 2117, which would tighten deadlines for mail-in ballots during an election. These bills were all introduced and sent to committees, but have not been discussed on the House floor, and delegates haven't had the chance to vote on them yet. But West Virginia Public Broadcasting will follow their progression through the House's committees and provide updates if they advance. We have a weekly feature with West Virginia high school students. This week, Malia Sarr and Emma Browning look at the makeup of the legislature and the West Virginia state government.
Hello, everyone. I'm Emma Browning.
And I'm Malia Sarr.
Before jumping into bill status and possible upcoming laws, it's important to understand how our government is formed and who is a part of it.
The state legislature meets annually for 60 consecutive days beginning on the second Wednesday in January. This changes when it's an inaugural year, like this year. When a new governor is inaugurated, the session begins on the second Wednesday in February.
West Virginia's legislature is made up of 34 senators and 100 delegates, each performing similar jobs, yet with significant differences.
There are 17 senatorial districts in West Virginia, and each one has 2 senators.
In the West Virginia House of Delegates, there are 100 districts, and each is represented by a single delegate. You must be a citizen of the United States, be eligible to vote, and be a resident of your district for 1 year prior to the election.
Once the delegate wins their district's popular vote, they're in.
West Virginia's Senate consists of 2 Democrats and 32 Republicans, with a single term being 4 years. Half of these seats are up for election every 2 years.
Members of the House of Delegates are elected for only 2 years. That means they're almost constantly running for re-election.
West Virginia's House includes 9 Democrats and 91 Republicans, but not every person holds the same role.
Each House has an officer, the President of the Senate, and the Speaker of the House. Every 2 years, on the first day of the new legislature, they are elected by the majority party of their House.
West Virginia's Speaker of the House is Roger Hanshaw, who has served since 2018, and the President of the Senate is Randy Smith. This is Smith's first session as Senate President.
Their job consists of giving members permission to speak on the floor, counting and declaring votes, appointing positions, and assigning bills to committees.
They both control what moves in their respective chambers.
The Speaker of the House oversees and manages all legislative activities within the House of Delegates. In addition, they are ranked second in line of succession to the office of the governor. The Senate President is first in line to succeed the governor and is considered to be the lieutenant governor.
Another role of the President and Speaker is to select committee chairs. There are a number of committees varying between the Senate and the House.
Additional officers play a key role in the legislative process as well. The President and the Speaker select the majority leader and the majority whip, whose job is to promote the party's agenda.
If the President or Speaker is unable to chair the floor session, they will act as the presiding officer.
The minority party also elects a leader to promote their party's agenda. Their leader then selects a minority whip.
Whips assist party leadership by managing the legislative program in the House and Senate. and maintaining communication between leadership of the party with its members.
Each leadership role within the House delegates and the Senate has an impact.
That's why it's important that representatives value the people's input so that they are able to advocate for us.
We hope you enjoyed today's program. I'm Malia Sarr.
And I'm Emma Browning.
In a committee hearing that lasted into the night, members of the House of Delegates grappled with healthcare regulation laws and heard differing opinions from more than 10 presenters. Emily Rice has more.
Some West Virginia lawmakers have been trying to chip away at the state's Certificate of Need laws with bills to repeal it introduced year after year. Certificate of Need, or CON, is a regulatory process overseen by the West Virginia Healthcare Authority that requires providers who want to create or expand healthcare services to obtain legal documentation proving those new services fit an unmet need in the area. House Bill 2007 aims to repeal the application process and eliminate the Healthcare Authority, leaving the incoming Secretary of the Department of Health, Arvind Singh, to enforce any moratoriums under the supervision of the state's Attorney General, J.B. McCluskey. Singh was the first presenter called to speak to the House Committee on Health and Human Resources on Thursday afternoon.
By putting CON decisions in the hands of bureaucrats, we are artificially inflating costs and determining winners from losers, leading to negative impacts to patient care. This must change, and that starts with the repeal of CON laws and the Healthcare Authority.
Singh argued that repealing West Virginia's CON laws would allow for new providers to provide more services without government regulation, which he and other proponents of repealing the law say would allow for competition in the healthcare industry, possibly leading to innovation. Throughout the 5-hour-long discussion, delegates from some of the state's more rural regions expressed concern that competition, if it does occur, will be focused on the state's more densely populated areas, worsening their region's lack of access to adequate care. Delegate Jeffrey Stevens, a Republican from Marshall County, asked about the possibility of further hindering rural areas' access to quality health care.
West Virginia being a rural state, some of us are from more populous areas like myself, I can go to a lot of places. I can do within 3 hospitals within 10 minutes. And I think, if you're going to be a business person and open up a surgical center or a hospital or anything like that, I'm going to go to where the population is.
Delegate Mike Pushkin, a Democrat representing Kanawha County, expressed concerns about viewing the healthcare industry as a business during Singh's testimony.
You said, like any other business, it's up to them. That's what you said? So you think healthcare is just like any other business?
I don't think healthcare is like any other business. It deals with people's lives, and it's a very, very important industry.
Delegates heard from 13 speakers in total. Witnesses ranged in representation from hospitals like WVU Medicine, Memorial Health System, Valley Health, and Mon Health, all of whom hold differing views on CON repeal. There were also representatives from research institutes across the country. Delegate Jonathan Penson, a Republican from Mason County, expressed some frustration with all the contradictory testimony the committee heard.
I think myself and several other members of the committee are kind of left in the same spot, meaning that we have half of this discussion telling us that competition is going to destroy the market, that it's going to destroy the healthcare industry in the state of West Virginia if we repeal CON. Then we have the other half of the discussion telling us the only way to improve the health outcomes, the health industry in the state of West Virginia is to improve the market by repealing CON. So, we're left right here in the middle trying to figure out everybody's facts and which facts are actually facts and which facts are conjecture.
House Bill 2007 is pending before the committee and may be taken up for a vote as soon as Tuesday. For the Legislature Today, I'm Emily Rice in Charleston.
A bill that would allow for broad vaccine exemptions cleared the Senate chamber today. I attended today's session and have this story. Senate Bill 460 would allow for broader exemptions to the state's vaccine requirements for children entering school. It's similar to, but more expansive than, a bill passed by the legislature last year. That bill was vetoed by then-Governor Jim Justice. Using an annotated map to make her point on the Senate floor, Senator Laura Chapman, a Republican from Ohio County, said the law will bring West Virginia in line with other surrounding states.
But let's talk about where we are in result to the other states. The red are states who do not allow religious or philosophical exemptions. California, New York, Connecticut, and Maine. Look at all the white on this map. West Virginia, we're kind of in the middle there, sticking out like a sore thumb. This law is not something crazy that anti-vaxxers want. This is bringing us up with 45 other states that realize that religious beliefs need to be respected, and they find that public health, it's safe and effective for public health to allow these children to have a religious or philosophical exemption.
Many legislators spoke against the bill. Tom Takubo, a Republican from Kanawha County, said passing this bill goes against the medical advice of nearly 30 West Virginia medical institutions.
The American Academy of Pediatrics in the state of West Virginia said, please don't do this. The American Cancer Society Cancer Network of West Virginia says, please don't do this. The American College of Emergency Physicians, the American College of Nurse Midwives, West Virginia affiliate, the West Virginia College of Obstetricians.
In a 16-minute-long floor speech, Takubo said that most constituents he has talked to don't want this, particularly private schools, who, under this bill, would be required to accept students who are not vaccinated, even if it goes against the school's policy.
So then that leaves the question for me, who wants this bill? It's not religious schools. I mean, the vast majority are begging us, let us decide on our own. That's the freedom of choice. It's not parents. People of West Virginia have overwhelmingly spoken on this issue. It's not the medical community. I think I've nailed that. So the only persons I can think left are trial attorneys, not all of them. But in Senate Health, the only proponent was trial attorney, a trial attorney from LA that makes his living, hundreds of thousands of dollars, his entire law firm, on suing on vaccine issue.
Dr. Stephen Eschenhauer is the public health officer for the Kanawha-Charleston Health Department. He says West Virginia children are especially at risk due to low vaccination rates for babies and toddlers.
West Virginia is different. We have one of the lowest immunization rates up through 24 months of age in the entire country. If those children are not immunized, we may see much lower immunization rates going into school than other states. When they bring up states that have reversed immunization policy, look at California. California had a number of these exemptions and then reversed it once they saw outbreaks. So as a physician, the easiest disease to treat is the one you never get. I can tell you that unequivocally. Unfortunately, we may have to learn the hard way through seeing the reintroduction of childhood diseases that spurred our predecessors, our grandfathers, our fathers, to pass laws to protect their children, meaning us.
The bill passed 20-12. It now heads over to the House for consideration. At the end of the week, our reporters get together to discuss some of the major issues they covered. Ultimately, we know we can't cover everything. So, we invited a reporter from a different news organization to join us to get a different perspective on what they have seen. This week, we welcomed Duncan Slade, the deputy managing editor for the nonprofit newsroom Mountain State Spotlight. I'm sitting here with Jack Walker, a reporter for West Virginia Public Broadcasting, and Duncan Slade, a reporter for Mountain State Spotlight. How are you guys doing?
Wow. Good. Thanks for having me.
Yeah, amazing. Jack, what are you watching?
Right, so I have been closely following the House of Delegates so far this legislative session. It's been a little bit quiet on the floor, but there's been a lot of discussion in the committee hearings. Specifically, today I'm going to be talking about the Certificate of Need process. So
Certificate of need. Explain, what is that?
Right. So, yeah, the certificate of need, basically since 1977, West Virginia, like a lot of states, has required new healthcare providers that are trying to open within the state to exemplify that they are offering services needed to the community they're going to operate in. So, proponents of the process basically say that's a way to ensure that the whole state is covered, that communities are getting the services that they need, and there aren't gaps in coverage. And that's sort of the origin of the process, but we've been seeing more and more states doing away with certificates of need in general, and that's how it's come to the West Virginia legislature this year.
I know that Governor Patrick Morrisey talked about this in his State of the State address. Who generally is for this, and who are coming out against this bill? I know it's been hotly debated. Definitely, yeah. So, like you said, Governor Patrick Morrisey has set it as a priority to repeal this process. That's something that we've also seen a little bit on the federal level. So with the Trump administration, I think there's been a broad effort to deregulate, for lack of a better word. And that has, trickled down to the state level as well. We've seen a few different public interest groups that describe as, free market interest groups coming to these committee hearings and speaking about potentially from, I guess, a market perspective, this process of regulating different hospitals and healthcare providers as reducing competition, and that potentially having a detrimental impact to patients as opposed to hospitals themselves. There, on the other side of it, has also been a little bit of concern about, I guess, a move toward privatizing different services, especially in a state like West Virginia that's very dependent on Medicaid and state aid for healthcare providing. So there's been dueling perspectives there. There is a bill, House Bill 2007. It hasn't been taken up to the House floor for a reading yet, but it was proposed by House Speaker Roger Hanshaw, a Republican from Clay County. And that is just to repeal the certificate of need process and also to eliminate the HCA, which is the regulatory body that oversees and administers that process. There's been maybe 30 plus, somewhere in the 30 to 35 range last year of new healthcare providers that sought the certificate of need to open within West Virginia's borders. So it is an agency that oversees a lot of stuff, but obviously if they were to do away with the certificate of need process, there would be less of a need for a regulatory agency for it. So very interesting. Yeah. We'll have to keep following that bill and see if it hits any of the floors. I'm sure we'll be hearing more about it. Yeah. I'm sure we will. Duncan, what have you been following?
So I primarily cover education, and the couple of things that I've been reporting on have been classroom behavior and the school aid funding formula. Very hot topic as well at the Capitol. When it comes to the school aid formula, it's a complicated 10-step process that involves ratios between enrollment and how rural counties are in terms of the population density. But it's important because it sets the funding that the state gives to local counties. Across the state, we've seen a wave of school consolidations. And when lawmakers talk about how they're going to address funding for public schools, they're quickly moving to looking at the school funding formula. What does this school funding formula look like now? Basically, it is driven by enrollment. So if you have more students, you get more money to pay more teachers, more bus drivers, more janitors. And it also pays for building upkeep and those sorts of things. It has some provisions that give a little bit more money to rural counties. And it does have also some aspects of it that provides for counties that have a very low enrollment spread out across a very large area. I know there's been a lot of talk at the Capitol about changing the way schools are funded or how in the state. What are some of those proposals? What is that shaping up to look like? Some of the things that lawmakers are talking about is, first of all, more talking about it, studying the funding formula because it is one big complex math equation. They're also talking about looking at how do we provide more resources for low-income students or students with disabilities, and giving counties more money to provide the services that those students need. Absolutely. You talked about school discipline. Yes, school discipline and classroom behavior has been a big topic over the last 3 months. The education committees, as they've been meeting in the run-up to the session, have heard from teachers who, in some instances, were violently attacked by teachers or by students, in the classroom. Wow. And those incidents happen, but they are relatively rare. Primarily when we're talking about classroom behavior, we're talking about students that are acting up. They're feeling a lot of emotion and they're struggling with that emotion, particularly at a young age in elementary school. And so that looks like climbing on cabinets, running out of the classroom, biting, spitting, maybe talking to the student next to them in class. And lawmakers have looked at this a couple of ways that they're talking about. They've looked at ways to give teachers more power to remove students from the classroom. And that has been the central part of what they've been looking at the last couple of years. They've made it easier for middle and high school teachers to do that, and they want to expand those same powers to elementary school teachers. But once the student's removed from the classroom, they have to go somewhere. And so right now those students are usually with the principal, or they might be with a school counselor. A lot of counties, particularly at the elementary school level, don't have what's known as alternative learning, where students can get specialized mental health support. There's a lower teacher-to-student ratio. And for students that are having a tough time at such a young age, these supports are really important. They can be really helpful in counties like Mon and Raleigh that have those supports, but they're not available everywhere. And so lawmakers have been pessimistic about what funding will look like for more of those programs. The Department of Education has a pilot program, but that will be something that I think lawmakers will continue to be talking about over the course of the session.
Now, correct me if I'm wrong, there was a school discipline last year that died, it just fell just short of the finish line. What was that bill like, and what are some of the solutions to this school discipline problem we have look like in this state? What are people saying?
Yeah, that bill would have given teachers in kindergarten through 6th grade the ability to remove disruptive or violent or intimidating, that's some of the sort of bill language. It would give teachers the ability to remove those students from the classroom. And in counties where there is an alternative learning center, or other sorts of programs, they would go to that program. That bill died right at the end of the session over disagreements between the Senate and the House about how do you define disruptive or intimidating. But it's back again this session. Senator Amy Grady has reintroduced it, and we'll see what happens as the session progresses.
Is that one of the main bills addressing school discipline, or are there others?
That's one of the major ways. A lot of the other things come back to funding, and it dovetails right into the school aid funding formula. Right now there's some money in the formula that it goes specifically to counties for alternative education, but a lot of counties are balancing a lot of different priorities, and so they might not be able to fund one of those programs, particularly in more rural areas.
Now, you said that the bill would have taken, the bill that's been reintroduced would take children out of the classroom. Where do they go once they're taken out of the classroom?
The way that the bill is written, they would be with the principal, and it would charge the principal to notify the parents who would need to come pick them up the same day. If the parents don't come to pick them up, the principal would have the option to contact law enforcement. Wow. And the goal seems to be with the bill, the way that it's written, to get those students into an alternative learning program, whether that's in their county or in the county nearby. But in the short term, it might look like a principal's office or something like that.
Very interesting.
Got it, yeah, and I'm sure we'll hear more about that as well. But Bria, I want to make sure we have some time to turn it back to you. I know you've been following some bills as well, so can you tell us a little bit about what you've kept your eye on and what's going on your end of things?
Yeah, so my end of things is generally the Senate, and the Senate has been passing and considering a lot of health bills. The Senate's Public Health Committee has been very busy. The two big bills that have been in there as of recent are vaccines, which just passed the Senate floor today, and trans-affirming care.
Right, and the vaccine bill, I know you mentioned, provides some exemptions to school vaccine requirements. Can you speak a little bit to that? And I know last year a similar bill appeared before the legislature. Maybe if you can tie that into how that bill fared.
Yeah, so that bill passed the legislature and the governor vetoed it. This year, a very similar bill, but actually a broader bill that expanded on the last bill, is moving through the Senate. It's good to note that the Senate is fairly more conservative this year as well, and it passed the Senate today. So over to the House it goes.
And we'll see. And you also touched on bills pertaining to trans healthcare. Do you want to speak a little to that? What kind of legislation are we seeing proposed in that regard?
Yeah, absolutely. So earlier this week, there was a committee hearing on trans-affirming care. A couple years ago, the legislature passed a bill that limited trans-affirming care in the state. In that bill, there were exemptions for a minor in the state who was experiencing gender dysphoria to such extreme levels that they were having suicidal ideations. And in that bill, there was an exemption to where those minors could go and get puberty blockers or hormone treatment. This bill that is being debated would close that. So if there was a minor who is experiencing suicidal ideations, or if there was a minor who was already receiving that hormone care or puberty blockers, they would no longer get care, or the person who is experiencing the ideations would also not receive care as well.
Right, and I know we might not have a ton of time, but I just wanted to ask, I know you've been sitting on some of the committee hearings about bills like this. What's kind of the impact that's being felt among residents, among lawmakers? How do they see that, playing out in terms of the lived experience of trans people in this state?
Yeah, they're very, very afraid for trans people in the state, and say that this could be a deadly bill for those people. That is all the time that we have today. Thank you so much, gentlemen.
Thank you, Bree.
Here we go.
Yes.
That's it for tonight. Thank you for joining us. Catch the legislature today, Monday through Friday at 6 p.m. And remember, West Virginia Public Broadcasting covers the session daily in our radio news program, West Virginia Morning, and on our news site at wvpublic.org. I'm Brianna Heaney. Good evening, and see you here again next week.
Support for the Legislature Today is provided by West Virginia University, offering education, healthcare, and the opportunity to achieve career success since 1867. Information at wvu.edu. Embassy Suites by Hilton Charleston, an all-suite hotel and conference center minutes from Yeager Airport and Capital Market. Reservations and brasserie dining information available at hilton.com.
Solar Holler, supporting Appalachian communities and building on West Virginia's history of powering the nation by bringing solar energy and battery backup to homeowners, nonprofits, and businesses throughout the region. More at